Room this evening for our Board of Education workshop session. We'll begin now with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America. Here. So moved.
I second that.
Moved by Dr. Ward, seconded by Mr. Harrell. Any comments? All those in favor of approval of the agenda as presented, say aye.
Aye.
And opposed, same sign. And the agenda is approved. This evening, we're going to be doing a little bit of a workshop model. We've been discussing this format a little bit, and it's our first effort into it this evening. Later in the agenda, we'll have time to talk about topics and session format, but first and foremost, we want to discuss the first day of school. And so I will turn that over to Dr. Clemens and his team for an update on that.
Thank you, Madam President. We're excited today at the first workshop model to be able to share some of the exciting things that occurred in our schools today. We had a wonderful start, and I think at 5:40, our last student got off our school buses, which is a success. As Dr. Cummings used to tell us, the three things that matter on the first day of school is getting them there, getting them fed, and getting them home. And so we're pleased that occurred, but we have lots of details we'd like to get into and share with you. As we discussed the new workshop model with the Board of Education, we thought it was probably pretty important to go through some norms. And so we've asked Dr. Daniels to start this meeting off before we get into the back to school report to help with a process to set norms to ensure that these meetings are productive moving forward. Dr. Daniels?
If you take a look at the document on your desk, they're the communication covenants. You might remember those from our recent retreat. If you look through those, what I'd ask you to do is two things. Number one, circle ones that you think might be pertinent for tonight's discussion, because this is a new format for us. As we enter into this workshop type of framework, we want it to be more conversational, having more discussion. So first, circle things that you think might be pertinent to tonight's discussion, and then if you see anything else that might need an addition made to it. So something else that might be important to encourage lively discussion and truly make this different than what our monthly meetings typically look like, then add that in as well. Okay, so one more time, you're circling things that are important for tonight, and you're adding things in where necessary. I'll give you a few minutes to do that, and then we'll return together. I'll give you one more minute. We'll start with additions to be made, and then we'll go back through which ones are pertinent to tonight. One more minute. All right, if you'd finish your thought that you're writing. Let's begin with some additions. So things that might be missing from what you saw in the paper. What would be good for this new workshop format? The circle is intended to generate conversation and discussion. Do you have any additions to the paper you see?
Some different paradigms, as shifting the way we've been doing things 100 million years and breaking that down a little bit more and talking about those kinds of things.
Great. I think that is important to remember as we try out a new structure. That makes perfect sense. Thank you. Other additions?
A good problem-solving model would be nice to have.
Paul?
Good evening. Again, if we're really talking about the agenda for the workshops versus the regular Board of Education meeting, I personally would rather see the workshops, the agenda for the workshops to be more programs generated, meaning that more student achievement oriented, in the fact that we could bring new programs or new ways to discuss, to continually put the focus on increasing student achievement, and that more operational items would not be part of the workshop model, but those type of items would be included in the regular board meeting agenda.
Thank you. So a strong focus on increasing student achievement, operational items shifted to the second meeting per month. Thank you.
Hitchhiking on Mr. Harris' thoughts. All this is process. So I was assuming content would come later. So, a fair assumption on my part?
Mm-hmm.
Okay.
Yes, definitely. Other additions? Okay, let's briefly highlight some things that might be really important as we enter into this new structure for tonight's meeting. What did you see on the list that's already there that stands out? Up. On this one, if you don't mind, we'll just go around each board member, just call out one thing that stood out to you that might be important for tonight. And because you are placed so closely to me, let's start with you, Dr. Ward.
The one I like to always remember is listen and seek to understand.
Thank you. T?
Reinforce our expectations.
Great. Carrie? Great. Thank you. Jane?
Probably, the sharing information articles, I mean, that's why I didn't hear we started the meeting, Carrie and I were talking about, different approaches to mathematics worldwide versus what we're doing here. So I think sharing that kind of information is important.
Later in this meeting, we'll have the opportunity to brainstorm topics and ideas for future workshop sessions. And if we want to do that, bringing in more research, more articles, book studies, discussions, we can do that too. So keep that in mind for later too. Thank you. Judy?
I have a couple. Respect diversity of opinion of others and ask and expect questions.
Thank you. Mr. Harrell?
Yes, I'd just like to echo many of the comments that were previously said, but in addition to that, probably put on there the very last item under communication with each other regarding the board members is don't expect that everyone knows what you know, so therefore please share information.
I'm hearing some common themes. President Calc?
Yes, I think the two others that I have selected that haven't been mentioned are remaining objective and utilize a sense of humor. Utilize a sense of humor and enjoy it.
Let's have some fun. That's right. Good. Okay. Well, I appreciate you looking back over our communication covenants. As we utilize this new process, we'll probably develop additional norms along the way to make it function to the best of our ability. In some instances, we will need something like what you see on the next page with the shapes on it, a discussion protocol. So for tonight's information about the back to school experience that all of our students had today, we wanted to structure it with a discussion protocol that prompts your thinking. That way we don't fall back into some old routines where we do a presentation, you simply ask questions, and then we all part ways. So we want this to be different, and we will try to pick discussion protocols that fit the topics and generate the conversation amongst us, okay? With that in mind, we'll give it a go with the back to school presentation and then utilize the discussion protocol. After that, we'll talk about some future workshop ideas and ways that we can improve it, and then some of our session format considerations. Thank you. President Kelly.
Ready?
Yeah.
Okay. Well, we made it. We made it. It took us nearly 6 months to have school again, but today was a pretty special day in the North Kansas City School District, and one day that many of us won't forget. It felt really, really good to see the yellow buses running through our city and delivering kids to our schools and seeing the hallways with students. Although they were 6 feet apart, it was really nice to see them. I got a kick today out of seeing all the different mascots or different tape marks throughout our elementary schools marking 6 feet. And the kids obeying that. And it was really truly a special day, and I'd certainly like to start off by thanking our staff and our parents for having the courage to step up and make this happen for our kids. Teachers were warm, welcoming, and they were very excited to see our kids. And that was district-wide. I made it to 30 of our 34 sites today. I just ran out of time. I'll get the other 4 tomorrow. Our kids were amazingly professionals. That was shared out to me today by one of our members that was visiting schools, and I thought, you know what, they're right. Our kids were extremely professional. They wore their masks. They did the best they could to social distance. They're just excited to be back at school, and were willing to learn and have a good time with that. We had a few issues with Canvas today. I think most of, it wasn't a district-wide issue, we just had a few hiccups out of school. Maybe needed to hit the publish button, or there was some hiccups, and we're gonna be able to manage those pretty good. But other than that, I was made aware at 5:40 today, our last student got off the school bus. And for us, that's a good sign. You can take that deep breath. And as I mentioned earlier, Dr. Cummings used to say on that first day, let's get three things right. Get them to school, get them fed, and get them home. And then from there, we start to do the exciting work of educating our students. And again, I just couldn't say enough about the work of the Board of Education directing us, our cabinet, our principals, our teachers, and our classified staff that pulled together to make today a pretty special day for a lot of kids. It was really like starting three schools, face-to-face school, a blended school, and a total virtual school. And I think Dr. Sutton mentioned this, and I hope I'm not stealing his thunder, but it really pushed us about 5 years into the future about what we wanted to do, and we were able to get it all done in probably 6 to 8 months. And now we just need to maintain it, refine it, and continue to provide those opportunities for our kids. So as that being said, we have a list of folks that are going to share out about how their departments was able to perform, and we would encourage questions, and hopefully we can provide those answers or get those answers to you. So I believe the first person, or I think actually we're going to do a video, and then we'll jump right into Jenny. So we have a video of our first day of school that we'll be able to show and kind of show you some of the highlights. The video shows just how important school is to this community and to us, and really puts us in the right frame of mind to talk about our first day. And with that, I'll turn it over to Dr. Gaddy.
Of those, we had 1,565 teachers who were more than ready to see their
This year, just to remind you, we added 4 elementary teachers and 3 associate teachers, 2 secondary teachers, and 3 special education teachers at the end of last year for our anticipated growth. So as we've worked through our numbers that I'll share with you shortly, just know that those are the additions we've added this year. We currently have 2 vacancies that I shared with you over the weekend, an elementary counselor and a high school chemistry teacher. We are actively recruiting for both of those positions. We have 2 early childhood special education positions open. That when visiting with Mrs. Monfort, we're going to hold off until December to look for those hires, as our early child special education numbers will continue to grow over the year, and she felt that she was adequately staffed at this time. So as we move through those numbers, we're going to look at the students who were in seats. I placed a sheet that looks like this at your table. This will give you a list of our buildings. The first column will have the number of students who were enrolled in schools PLP. The next column will have students who were enrolled in Canvas. And then the next column are those in-person student enrollees. As you look through the next column, it will have the yellow, will have the building average ratio for student to teacher. So as you can see, for our classes, those are really nice. We do have a couple that Mrs. Havens and I are watching at the elementary level that are 23, 24 students that are already in person. And so we're watching those as some students are making the decision to transfer from Canvas or schools PLP back into in-person learning. So we'll continue to monitor those closely. The next column over talks about the Canvas and in-person numbers, and then the last number will give you those Canvas and in-person student to teacher ratio at the building average. You can see we have has low at the elementary level, has low as 12 students per classroom, and as high as about 19 students per classroom. And the high school is sitting right there the same, is that 14 per classroom up to 22 per classroom. So just as we said, really nice class sizes of in-person learning where our classes are able to social distance and provide some of that space as we move through the day. Right now, we have 723 students enrolled in schools PLP, and that's K-8. In Canvas, preschool through 12th grade, we have 5,158 students enrolled. And then in person, we're just over 15,000, and that's also pre-K through 12th grade. At the elementary level, we have 15 teachers who are solely teaching virtually. We have 85 teachers who only have in-person students, and we have 304 who are doing a hybrid model. And then, of course, at the secondary level, all of our students are being taught virtually and in person through the hybrid model of 2 days a week, Monday, Tuesday, and then the Thursday, Friday section. Again, Mrs. Havens and I are continuing to watch the elementary numbers to make sure that as students are making the transition back, that we're able to have social distancing in the classroom and making sure that our numbers remain appropriate. And with that, I'll turn it back to the workshop model. I'm sorry, we go to questions.
I was just curious, when you're counting the hybrid, what shows up as a teacher workload? In other words, at home, whatever we're calling them, A and B, is it the sum of all 3 in a class? Okay.
So we have, what we would have would be some students are doing their online instruction and some students are face-to-face. The schools PLP are pulled out and they're taught through a different model.
Okay.
Just so I'm clear, same students Monday, Tuesday, or is it Monday, Thursday?
No, same students Monday, Tuesday, new set Tuesday, Thursday. I think it's 8L Monday, Tuesday, Chad? Yes, 8L on. And with that, I'll turn it over to Dr. Hilbitz.
Very good. I thought today I would share attendance data with you. So if you see it on your
today, wondering what those numbers would be like. And to be honest, if you had asked me at the beginning of the day, I would have told you that they were going to come in actually a little lower than they did. I was very pleasantly surprised to see that our face-to-face attendance was a tad over 90%, and that our overall attendance was over 93%, close to 94%. I will tell you that I absolutely believe that those numbers will continue to go up as we move forward, and have no doubt that our overall attendance as we move through this school year will sit above 94%, which is where we have sat generally for the last few years. I'll give you a minute to look at the sheet. It's a little bit confusing. I'd be happy to answer any questions on.
Where,
Yes.
while others may be thinking, generating questions. Perry, when we have students that haven't shown yet and the principals are still trying to find them, will they be pulled out of that 94%, or is that where we are today?
So the only time we back a student out who hasn't shown up is if they never attend 1 minute of one day, then they'll back out and that overall attendance rate will go up. It's very important for us to make sure that any student who doesn't show up, we work very hard to contact that student and their family. We have social workers and administrators who go out and do home visits. We don't want anyone getting lost in the mix. And then we'll work, if it's enough days, we'll then turn and partner with Children's Division to make sure that all our kids are safe and that all our kids are receiving some sort of education as mandated by law.
And is there a number to that some days? It used to be 10 when I used to work in that area. Is it still 10?
So 10 is what triggers the contact with Children's Division.
Okay.
Yeah, but because we have gotten better at it, we tend to be much quicker to send our own staff out to go ahead and knock on doors. And we even borrow some of Dr. Evans' staff with safety and security to go out. Rob McLeese has been very helpful with that as well, in partnering with our social workers to do that work.
I guess my question deals with Northgate at like 88%, which seems like way off versus the other middle schools. Is there some thoughts or ideas as to why that school would be that far off?
I don't know that I have a good answer to Northgate. I know Northgate has struggled a little bit with attendance over the years, but it's a different segment of our community in just culturally. If you look at the makeup of it, I again believe that the folks at the school will work hard to bring those families in. But I'll be honest, I was not real shocked that they came in a little below.
And I did visit with the principal there today. I showed up during dismissal time, so I didn't want to take too much of his time. But when we discussed it, he said he had a lot of students changing. They may have signed up for virtual, but have now chosen to come back face to face, or we're going to plan going face to face and now would like to go virtual. I don't know if that plays into it, but he said he had several calls today in that realm, so we may have to kind of sift through some of that information as well.
I'll add that we have more families in that attendance area who will actually leave the country and come back, and oftentimes that's a delay in the start, in the delay in those numbers.
Do we have any sense about the shift of population in homeschooling
this year from prior years?
I will tell you that right now our numbers are a little higher than they have been in the past, but I will also tell you that because of our ability to support those families now K-12 with distance learning, that I will be surprised if those numbers actually don't go down over the year. We are just starting to work and re-engage or engage those folks so that they can take advantage of something that their tax dollars support, and that is the curriculum instruction, even if they aren't going to come physically to school.
And we're hoping to get more of those folks to join us, because we think what we have to offer is better than most of whatever else is out there. Not that that was meant as a commercial, but if you are a homeschool family and you're interested in accessing curriculum instruction, give us a call in Student Services and we'll help you come join the fold.
Just as I recall, when we approved the contract for the PLP, it was a number considerably below 723. How are we going to absorb the budget, and how surprised are we that we're at that kind of a level?
In terms of the budget, we are just reallocating resources within the curriculum and instruction department. As you can imagine, this year we don't have the amount of professional development that we used to have. And so we're just taking some of those funds and reallocating them to cover schools PLP.
I think the second half of that question, Chad, you may want to address is that number's a little higher maybe than what you thought.
Yeah, maybe a little bit. You know, it really was a guessing game because we've never had an offering like this. And so I think what it told us is that we do have, you know, a number of families that want to be able to have their kids learn at their own pace, and maybe not necessarily the pace of their peers, or maybe they want to learn at different times throughout the school day, just based on the needs of families. So that option really provides families with the most flexibility, and I think that we saw we have more families than what we anticipated that wanted that best met their families' needs.
And Dr. Ward, I would just suggest that this data will be more important for us around winter break or next spring to see how many stay with schools PLP or shift back to Canvas or face-to-face. I think sometimes we get into things and we're not 100% sure that's going to be the best fit for our family, but after a few months we can adjust and then find what works for our family. So I'm anxious to see those numbers in a few months.
What is our, I don't know what to call it, adjustment policy? Can anybody go from category to category at what frequency?
Well, we've asked all of our school PLP families to commit to at least a quarter to schools PLP. So, you know, as you can imagine, we are already getting requests from families that maybe started in schools PLP that want to really take a look at Canvas, some of our Canvas families that want to take a look at schools PLP. So we're working individually with those families to make any adjustments.
I mean, Dr. Clemens mentioned Canvas versus in person. And is there a lot of shifting, and how flexible are we with that shift?
We want to be as flexible as we can with our families. And so we did have many students throughout the district today that just showed up in our schools with their parents asking if they could go ahead and make the transition from Canvas or full virtual to face-to-face. And we're making those accommodations for the families. We said from the very get-go that we want to be able to serve the needs of our families, and we're trying to be as flexible as we can. And really the Canvas option gives us that flexibility, because in a sense our direction in the Academic Services Department as far as the use of Canvas is to teach like all of our students are virtual. And if we teach that way and we plan that way, it allows us a significant amount of flexibility for students to come and go. And so we're set up to be able to do that. We want to accommodate our families.
So I think Dr. Sutton may talk about a little bit about the tracking of it, but that's not how it's defined in state statute. So it was, if I remember correctly, about 5 or 6 years ago, before we were in the position we're in now, when they created the model for capturing virtual attendance. And the model was meant to, or it was designed to allow schools and students to offer flexible options that weren't, so the old rules of you counted how many minutes your behind was in a seat in the classroom, they wanted to break from that, and this was their opportunity. So what they did was they took those parts out. It's not required for a student to log in X number of minutes each day. The idea is that it allows a flexible model so that one student may absolutely choose to use sort of a traditional approach where they log in on a regular schedule and do the work that way. And we may have others that fly through the work very quickly and don't require quite as much time. And so although we do track how much time they spend, it doesn't necessarily correlate into how effective an experience or how successful that student was. I'm not sure if that answered
So
your question
Perry,
exactly.
it's on completion at 94%. Is that how you're paid on virtual?
So the way virtual attendance is when I report it to the state is based on when you entered the class and when you left the class. So you have to enter before a certain point and you have to stay in until the class is complete. And we will receive then 94% of 100% of attendance for those students. That's correct, yes.
If no further questions there, I know Dr. Evans is ready to tell you about the operational side of the first day of school today.
Thanks, Dr. Clemens. Yeah, we did get, yes, we did get the kids to school. We got them fed and we got them home today. So that was goal number one. It looked a lot different, I think, than what we have seen in the past, but there was also a lot of similarities. So starting kind of on the food service side of things, we did get the USDA waiver. I know we sent that out. Dr. Clemens sent that out to you as well as in the Friday memo. I don't think that is, even though we've communicated that out through our departments and tried to do as much as we can, I think families are still wondering maybe what that allows for, because it is certainly different. So we'll continue to push that to our principals and all their ways that they communicate with their families, because although we served over 10,000 meals today, that's light when it comes to even at a 6 through 12 partial schedule. So we'll continue to do that, but we've done it now with sack lunches since March. So we know what we're doing on that deal. One thing I will say is it was kind of cool. As I was at Oak Park today, we had our meals. I think they have 11. I think they have 11 lunch periods. But you go out front, and we're also serving drive up for our virtual kids, so they can be fed in the building, or there's a line of cards going out and making sure that our students are fed that are virtual, or they're just coming on Thursday and Friday. So that was an interesting way of interesting approach, but I think it was a successful approach, and we know it'll continue to grow, and we have that waiver through December. But one thing I want to make sure I point out is that we need our families to still fill out the paperwork for our free and reduced, because there's a lot of other benefits other than free food service benefits that our students and our families can get from this. A lot of ACT, SAT, some other things that they can get waivers on with that paperwork. So we do encourage our families to continue to do that, even though we do have a waiver through December. Transportation was light. Obviously, when you do 6 through 12 on a partial schedule, it's going to be a lot lighter. But the actual numbers he was working on, but we only had 4 buses that were running late. I think that's probably because we've been kind of doing this again with summer school in July, as well as our extended day schools. We've been kind of going through this and doing this, so we kind of have our processes and procedures in place, and the reports back from both Michael and Food Services, and I think that Dr. Sutton will hit this too. Masks were being worn in the buses. Kids were doing what they should be doing. We didn't have to stop and fight. Like we heard the other night at the board meeting, we did provide masks if we needed them. Very few were handed out. They all had their own special Spider-Man ones and everything else. So it was, but we did have them available for kids. But we did get them home by about 5:40 today. We expect our numbers to continue to grow when families either come back to school and or figure out, hey, they know what they're doing. Let's get them on the buses and get them to school, and that can be a benefit for our families. Since our transportation was light, Rob McLeese and his team saw a real heavy drop-off for families, which is to be expected. So we had additional deputies at the elementary schools as well as our sixth grade centers to help with traffic control before and after school. We will continue to provide that service until it either levels out a little bit more, or that maybe is our new norm, and we'll do that as well, as long as it takes. But we did notice a significant car rider buildup at the elementary school level through sixth grade. So we have additional resources. Rob and his staff are on it, and we had a better afternoon than we did morning, and we'll continue to evaluate that. But we got them there, we got them fed, and got them home, and we'll do that again tomorrow and the rest of the year, hopefully. So, any questions?
You mentioned the lunches, and we're getting really good at handing out sack lunches. What about breakfast? How is that handled?
It's the same. We have breakfast and lunch being served in schools, in the classrooms. Actually, there's depending on high schools and elementary, they've worked with their teams, their back-to-school teams, to figure out the best way to provide those. But anybody that wants a breakfast, anybody that wants a lunch can get one. And I do say they're sack lunches, but they have menus, they have everything ready to go. They are providing different options. So it's a full service menu, just like it would be. It's just distributed differently, but certainly breakfast is the same. They can get that in the morning as well.
I have a question in terms of flow, the kids entering the school, accumulation in the hallways and all. I don't know if you're the one to respond about that, but I was curious how that all was orchestrated, and did that go smoothly?
I could take it.
Okay.
Very well. We shared our return to school plan with principals back in early June. And so they have been preparing for this day for months now. And being at some schools this morning as kids were coming in, it was a priority to get your hands washed or sanitized, breakfast, and directly to the classroom. So as far as congregating in hallways, our principals did an amazing job, and teachers, of getting kids right to class and not allowing any huddles of kids and congregation of kids to come together. So I was really impressed with how they kept that flowing this morning.
And Madam President, I might just say thank you to all the kindergarten parents that gave that ride up today to walk their kids directly to class and turn them over to us at the front door so that we could try to keep as many visitors out of the building as possible. Big thank you to them for trusting us to make sure that their little ones got to their first day. And pre-K moms too, okay.
Experiences in July, even on drop-off and traffic, and certainly our principals at Wynwood and Crestview have shared that experience with Dr. Sutton and his team, as well as Michael. And so we've coordinated what we learned in July, and we'll continue that process moving forward.
Because you oversee a lot of the construction and some of those elements as well. We weren't to the last day of opening anything new, but we're parking lots and playgrounds and all of those things.
We are. I just got a report from Jeff as we were coming in here today that our lights are supposed to be delivered for Staley. As you can see, it's about that time we're going to start needing those lights. They come in next Wednesday. And so as soon as the poles are already here, but the fixtures come in next Wednesday at both the high schools, at Northtown and at Staley, and they'll just go right up when they get here. They think they'll have Northtown done by Friday. We're going to push them hard to get done by Staley on Friday too, with the events and everything. Playgrounds, topping is done. We're installing the turf underneath the playground. We went to more of an artificial surface underneath the playgrounds, so that is going in right now, currently at Shoto, and then they'll move over to Chapel Hill and finish. So we knew it was going to be tight because we didn't get to order the equipment until after we passed the bond, and they said 6 to 8 weeks, but we went forward anyway. And because we figure even if it's a little bit, whether it's this week and Chapel Hill be on it next week, those students will get a brand new playground for an entire year almost. And so we feel good where we're at there. They had a little delivery snafu, Jeff told me today, where they were trying to deliver the padding during bus drop-off. That didn't go well when you're trying to bring a truck in. So Jeff worked through that, but otherwise, the only other thing we're waiting on is some doors to be shipped. Some of the security doors that we're replacing at 2 of our buildings. But roofs are done and asphalt's in, and we have a little, we waited with the weather change, to get some landscaping done at all of our asphalt projects. So that's going in currently at a lot of our facilities too, but that's just because we wanted to wait till better weather to seed and everything. So pretty good as far as with a little bit later start with the bond, we're going.
I have to say, it was a little bit of a mess at Shoto today. I pulled in right behind the semi truck and that was delivering some of the goods. But Mr. Vandal was there, and we were able to get them back onto the street so that school could go on. I told the principal, if that's the worst thing that happens today, we've had a pretty good first day. And I think everybody just worked to make it happen.
I'd just like to add that hopefully by delaying the start of school from August the 24th to September the 8th, really did give our staff, specifically our principals and our teachers, more time and more comfort level to actually prepare for today.
This afternoon, I think that a lot of those who visited the building and shared out with Dr. Sutton's team would agree with that they felt a lot more at ease and comfort and prepared because of that extra time that was benefited.
I know Dr. Sutton wants to share some things about academics, as well as some new information we continue to learn about how we're tracking COVID cases in our school district. And I know that that's really important information, and we want to be as transparent as possible. It's really hard to be transparent when the numbers keep changing and things keep changing within our community. So Chad and Dr. Shanks are going to share a little bit of information of how we're going to attempt to do that.
Yes, well, what a great first day in North Kansas City. And, you know, throughout the past few weeks, throughout the past several months, North Kansas City, like so many school districts throughout the country, have certainly experienced significant adversity in terms of getting to this point and opening up schools. And I will say I couldn't be more proud of our 3,600 plus employees that came together today to not only provide our kids with a high quality learning experience, but to feed them, to transport them, to take care of them before and after school, to disinfect areas. Everybody came together to provide our kids with an amazing experience today. Just couldn't be more proud of everybody and to be a part of this school district. You know, there's several celebrations today, and it takes me back to a webinar that I was on last week with several of the chief medical officers throughout the Kansas City area. And they talked about 3 pillars of prevention. And when they talked about these 3 pillars of prevention, they talked about how through applying these pillars, they have seen absolutely no spread of COVID-19 within the hospitals. And those 3 things are wearing your face covering, frequent hand washing and sanitization, disinfecting, along with physical distancing to the extent possible. And as I visited schools today and as we debriefed as a team, it was everywhere. I was so proud of our students, our staff. Those 3 pillars of prevention were in every single one of our schools. And so really, really proud of how seriously and professional, as Dr. Evans mentioned, that our staff, our students took today and really applied these practices to keep all of our students and staff safe and to minimize risk within our schools. Today, the focus in classrooms was on relationships. It was so awesome to walk in so many schools today, and a lot of times, the first couple of days are all about rules, procedures, which today was about new rules and new procedures, of course, but I walked in a number of classrooms where students were just circled up and reconnecting with their peers and their friends and reconnecting with their classroom teachers. I walked into one classroom today at Newmark. It was an Avid classroom, and you know, you walk in there and it's all just exciting to see kids and ask them how their first day is going, and one of the young ladies said back to me, she goes, I have been waiting for this day for so long. And you could just feel the excitement to be in there and to connect with her teachers and peers was just a significant day. And one of those things I think that often in schools we overlook, that the benefit of kids being with peers and with their teachers and the social emotional impact that has on kids and their mental health is significant. So great to see that today and the focus on relationship building. You know, today, all of our teachers throughout North Kansas City were teaching in ways that they have not been trained to teach, throughout the past many years or in their teacher training programs, and have been so proud of the way that our teachers have embraced Canvas, have embraced taking both virtual students and face-to-face students and finding ways to meet the needs of both was so impressive. We offered these last 2 weeks professional development sessions to all of our teachers. They're 30 minutes in length. They are not required. They're all voluntary. We had over 2,200 teachers that enrolled in those sessions. Incredible. 2,200 enrollments, not 2,200 teachers. 2,200 enrollments in those sessions over a 2-week period of time. And if that doesn't speak to how committed our teachers are to learning and growing and serving the needs of our students, I don't know what does. That was just amazing and blew me away. So proud of our teachers. As Dr. Clemens mentioned, the overall use of Canvas today was great. We certainly had some hiccups with it, some challenges, just first-time families logging in and trying to figure it out. But we've got some plans in place to support our parents more directly over the next few days so that we can answer their questions and keep them moving through the process so that their kids can stay engaged in learning. And, I think the other thing about today, it may have been the coldest first day of school ever in the record books. We're going to have to go back and look at that one, but I don't ever remember starting a school year with such a chill in the air. But what an amazing day, and I just couldn't, again, be more proud of the way that this entire organization has come together to serve the needs of our kids. So as far as challenges ahead, while our criteria for decision making certainly provides us with a good foundation to make decisions about how we're going to have school, there are certainly a significant number of variables. And the closer we get to this data, the more we learn about this data, the more we have to value the importance of partnering with our health officials to make decisions. Because as much as we would love to have clear-cut criteria that we say, as soon as our numbers are here, this is what we do, we're learning more and more and more that that's just a real challenge as we learn about all of these variables and the data. So it is going to be critically important that we partner very closely with our health officials to provide context to not just the data that we have on our decision-making chart, but additional pieces of information as well. And I'm going to have Dr. Shanks come up and join me. Dr. Shanks is our Director of Assessment and Accountability in the Academic Services Department, and we hired him to focus on data and assessment and accountability as far as student achievement goes. Little did he know that I was going to come over to his office one day and ask him if he would help me with some COVID data. And so it's taken off from there, and we continue to learn a lot, and he has just done a fantastic job in partnering with our health departments and learning about all of the variables. And so I'm going to turn it over to him to share a little bit about what he has learned.
Thank you, Dr. Sutton. I've had the opportunity to learn a lot about COVID, in the last 3, 4, 5 months. I like to start with an analogy that I want you to think of as we start to talk about the data. A bullseye analogy. So we have data coming in that reflects our zip codes, and that would reflect the center of the bullseye. And then we're also looking at Clay County, Kansas City, Missouri. We're also looking at the 9-county area. Then you could take it out even to the state of Missouri. So like Dr. Sutton mentioned, I think there are some that want the data to be direct, where this number indicates that we do this, but it's just really not there. So we use all those different data sources to pool together to help us make those decisions. So a couple things that I've learned in regards to like our criteria for decision making, the 2-week cumulative incident rate. So that's figured by the number of cases in the last 2 weeks, and then they take that by the total population, and then they give us a rate. So that reflects the total number of infected patients, if you will, per 100,000 in the geographic area. So that number in Kansas City, Missouri, the denominator, if you will, right now they're using 481,000, give or take a few. It's 481,000 some change. I'd have to look at that to give you the exact number. But that's an average of the total population of Kansas City, Missouri from 2014 to 2018, so in that span of time. So when COVID started happening, and Dr. Sutton and I were talking about a metric that we needed to use, that was one of those. So it wasn't readily available. So I was hand calculating the 2-week cumulative incident rate early on, and I was using a figure of 495,000, and that's a figure that was readily available on the internet from census.gov, and it reflected a 2018 population total for the Kansas City, Missouri area. Now also I've seen a number of 505,000 for the Kansas City, Missouri area population, and the context that I saw that number in was around like the CARES Act, and for a city to receive funds from the CARES Act, they need to have a population of 500,000. So the number that was being reported there was 505,000. So if you take any one of those numbers with the denominator, it's going to change, the figure that we look at. So like Dr. Sutton pointed out, that definitely becomes a challenge. Also within that, roughly about 2-3 weeks ago, mid-August, right before our last board meeting, the Kansas City, Missouri Health Department changed the way that they count and track COVID patients. What they were doing before was once a positive test cleared the health department, then that's when it was tallied. So if you notice possibly, about the beginning of August, there was a lot of talk of cases on the rise in Kansas City, and the most number of cases in a day, and that was what was being reported in news outlets. And then so Kansas City, Missouri switched gears, and then they started calculating that total based upon the date that the person receives the test. So if I go, I receive a test today, then it would be counted for today. Where prior, it was counted when it cleared the health department, and sometimes that was months. So obviously the data was inaccurate in that regard. Another interesting thing that I found out about positive tests as well. Right now, if you go receive a COVID test and you are counted as positive, that testing facility has 24 hours in which they must report that to the health department. A positive test, 24 hours. If the test is negative, there's not a timestamp when that negative test needs to be reported to the health department. And our partner in Kansas City, Missouri, she's disclosed that it sometimes takes 2 to 3 weeks for that negative test to get back in and be totaled in the count. So, just to give you an example, if 100 people received a test today and 10 of those people were positive, 10 of those cases would be reported, tomorrow in 24 hours. But say only 10 of those negative tests filtered their way in, so then that number would reflect 50%, 10 of 20. But there's 80 other tests that are out there, kind of in the wind, that could trickle in within the next 2 to 3 weeks that obviously would change that number as well. So when people want to look at the positivity rate, it's a challenge. It's not meant to be looked at that way. And like this past weekend in the Wall Street Journal, there was an article. The title's "COVID Positivity Rate is Useful but Flawed," and I'm just going to read you just a little paragraph about that. It says, "It's not a measure of the percentage of the population that is infected or even a measure of the incidence of new cases," said Jennifer Nunzos, an associate professor of Johns Hopkins Bloomberg School of Public Health. "It's a measure of whether we're doing enough testing." So in reality, that number is an indication to the health department whether there's enough testing being done to determine the infection rate within the given population. So if you look at that number in Kansas City, Missouri, I just kind of checked it out a little bit ago. It was 8% and some change. And Kansas City has a goal of around 1,000 tests per day. The Clay County positivity rate was, it's about 13% this past week, but they did a significant less number of tests. And then along those same lines, I mean, if you the news reports or whatnot, like I just received, I'm on an email list from Children's Mercy Hospital, and I received an email this afternoon that said, they have free COVID testing for children at Children's Mercy Hospital, but they need to be symptomatic to receive that test. So too, if symptomatic people are being tested, of course that rate's going to climb a little bit. So I think we need to be wary of what that rate is for, when we try to make those decisions. Also, I'm sure you read, like I talked about the lagging rate. Also, Kansas City, Missouri is getting better at shifting out the doubles that they had in the data. Meaning, if I was tested today, then I was tested, a couple weeks later. Before there was 2 tests in the data. As they switched to that new system, they were catching those numbers and pulling those back out. So, I think the health department's learning right along with us. They've never been faced with a pandemic either, and they're making adjustments on the fly, much like we are in a school setting. Right now, the medical information that I read says that we're in a thing called a fluctuating plateau. The cases per 100,000 within our zip codes right now, I just received an email from Kansas City, Missouri, was 175. Obviously, like Dr. Clemens has talked to you before, the Kansas City, Missouri cases are much higher than that, but Kansas City, Missouri, includes Clay, Platte, Cass, Jackson counties, and then the uniqueness of the data as well is that, like, Clay County data excludes Kansas City, Missouri, which is a huge chunk of our school district, obviously. So, like Dr. Sutton mentioned, we've had a unique situation where we've partnered with Kansas City, Missouri Health Department, and there's a public health statistician that she sends me a report every Tuesday. And within that report, what she's did is she's taking these zip codes of our school district and she's reporting those numbers to me. So again, that's the middle of the bullseye that I think is a starting point as we take a look at some of that stuff. And I forgot to mention this, like, as I was talking about the 481,000 number, the 495,000 number, and the 505,000 number, just to give you an example, I went back and I pulled like enrollment numbers for our school district, and from 2014 to 2018, we had an average of 19,434 students. Well, last year in our September count, we had 20,435 students. I live in Pine Grove, right east of Staley, and the street that I live on did not even exist in 2018. So, I mean, the numbers, I feel like the population numbers are more, obviously, than what is being reported and used. So that does make a difference when you do the math. It most certainly does. So.
And the other recent change is that most of our local health departments have come together to establish some regional gating criteria for the Kansas City area, and we are still awaiting, unless it was published today, Clay County to publish their gating criteria. And while Clay County's looks very similar to ours, there's some different language in some of their criteria. So as soon as that is made public and published, we want to take a look at that and also consider some adjustments so that we align with the regional gating criteria as well. There is now a regional gating criteria website so that you can track the data. Some of the data is accurate, and some of the data you have to go to the epidemiology section of the Clay County Health Hub in order to get the Clay County data, because they get the Kansas City data and they've got to go through and scrub it to be sure that they're taking out all of the Kansas City data and just using the data within their jurisdiction. So that's getting to become more accurate as well. I always joke with Dr. Shanks and say, you better quit learning all this stuff, and because at some point the health department's going to come grab you and take you away from me. But I certainly appreciate his time and efforts. And again, we are learning so much about all of this, and it's important that we do so that we can make the best decisions as we continue to move forward. Question?
And I would just say that I'm very appreciative of Dr. Shanks and Dr. Sutton for working this piece. When you try to be transparent and share the metrics that made up our matrix, what we were able to do is give a good base for other people to use. Now it continues to evolve, and as it continues to evolve, we learn more. And when we learn more, we're going to try to share what we've learned to ensure that we're doing the right thing by whether it's face-to-face, virtual, hybrid, whatever. We want to make sure that we're doing the right thing. So as soon as we get more information, we'll continue to share it. And I think the key to what we are doing is Dr. Archer and Mr. Zobarak, our health department officials, that we stay in continued contact with to ensure that the direction which we're going is the right direction for our community.
I do think it's important that we, thank you very much, because we hear positivity rate and we think of that as an absolute. And things like what you're talking about with the timing of the negatives flowing in over 2 weeks and finally getting them realigned is, it isn't an absolute. And at this point, it's a floating number, quite frankly, just because they're learning, they're refining, and they're doing everything else. I just happened to go on the Clay County website earlier today, and the report that they had was that the positivity rate in Clay County was like 14%. But if you looked at the little bit of the data right above it, they had 54 positive tests last week. The last time they had 54 positive tests was in June. They've been running 70, 80, and 110. So if you look at the positivity rate, it sounds frightening. If you look at how many actually tested positive, it looks celebratory. But it depends which number you pick, what you're looking at. And so I think we're well served to have someone who's actually digging into this and looking at it, because it does. If we take an absolute number as gospel, we're probably not going to make good decisions. And so I think we do have to, and I appreciate what you're talking about, that we do have to be very careful as we look at our metrics and as we try to provide that information to others and let them be transparent about the decisions we're making, the causes of those decisions, and everything else, that we're not propagating bad data. So I don't know whether we need to. I would just suggest that we think about. I don't know the answer, and I'm not sure at all, but we think about whether or not we find our own way to communicate where we stand vis-a-vis the metrics. In other words, take your knowledge, refine what's coming out of all of these sources, and come up with our own North Kansas City scorecard that does lead us, as best we can discern from the data that's there, to decisions that are relevant and true to our intent. It may be too early for that. I mean, we're seeing this stuff getting refined and getting developed, and so it's kind of, but I think, as we look forward in the next 2, 3, 4, 5 weeks, that may be where we need to go. And the other thing you've got to remember is that Clay County number I looked at represents the part of the county that we have 20% of our students in. The Kansas City number is 80% of our students. But if you catch the Kansas City number for Clay County, it also includes parts of Liberty and Smithville and everything else. So it's not a pure North Kansas City number either. So I don't know if it's possible. It may be theoretically achievable. It may not be practically achievable. And I mean, we do have student performance to measure, and we shouldn't all be just chasing COVID numbers. But if we can find a way to get something that our patrons can look at with, a simple paragraph of explanation, that may be something we want to do, because and if we can't have something that our parents can look at least something that we can use to make the right decision about how we are educating our students. Because the data right now can lead us to some freakishly bad.
Two questions. Hitchhiking on some of Dr. Ward's comments. I'm under the assumption we're looking at positivity rate for our zip codes.
We are beginning to get positivity rates for zip codes, and we also look at Clay County and we look at Kansas City. So we do look at all three of them. Okay. Yeah, but just with our zip codes, it's also some of that data constantly changes, even 2 or 3 weeks down the road, because of when those negative tests are reported, which impacts the denominator in the positivity rate.
Well, and I can also appreciate the mobility of our society, that our neighbors can impact us just as well as we can impact them. My second question, I can't remember if I read it, saw it, or heard it, so I don't know if it's fact or not. So it's a question of, I have heard that we're cutting back in the area, I don't know if it's metropolitan-wide or Clay County, on testing. Is that a fact? Or?
I don't know that that's a fact. I do know that there are thresholds for cities to meet in terms of being able to have, for positivity rate data to be valid. And so I know Kansas City, Missouri, for example, I think their daily goal is 1,000. But what we do see is you do see some testing clinics that will, like Dr. Shank said, that will only recommend testing for those that are experiencing symptoms. And so when you go to some of the different testing websites, you will see that some of them are open to anybody with or without symptoms, and then some are open to just those with symptoms. So that could discourage some people from going to get tested, of course.
Yeah, and my concern is that we're going to err. I want to err on the side of caution. So my concern, if tests are being reduced in terms of numbers, the sample size is less, you'll probably find less. So I don't know what that means to the people in charge of the number of tests, but I'm hoping with all the variables that we're not being underreported.
I guess the data I look at suggests that the likelihood is not underreporting but overreporting, because they're capturing the positives and they're reducing the denominator. So if for instance, there's 100 positive cases identified any day you want to pick, if they hit their 1,000 tests, that's a 10%. What's happening right now is it's more likely that they got 600 tests, and so that becomes a 16% positivity rate. So my concern right now is not underreporting, but overreporting. And I think that's the other thing, if you look at the Clay County data, their number of tests administered is dropping the last 3 or 4 weeks from where it was. So you've got the positivity rate going up, but the number of tests administered going down, and until last week, basically a fairly flat number of positive tests. So it appears that Clay County is on the rise as far as positivity, but when you look at the data, it doesn't support, if you really start looking at the pieces, parts that are going in there, it doesn't really support that. It really shows flat to dropping. And so it really starts to get really weird. So I don't think there's a good generalization that could be made, but I do think by going at least 1 layer or 2 layers deeper, we can start to understand the true implications of that ratio that is right now, in my judgment, probably tending to be on the high side rather than the low side. Hopefully that's helpful.
Told me that we are receiving once a week reporting of in-district zip codes from the health department. Is that right?
Yes, we are now getting that zip code data, and some of those zip codes do encompass other school districts as well, like but not a significant number. But yeah, we are now getting that from.
So in your assessment, that information is probably as accurate as any information that you have to make a really solid decision. We don't have to go back in necessarily and adjust for or reinterpret it, or help me out with
Yeah,
that.
I mean, I see what you're saying, but the thing, I guess my point being, keep in mind that they're using still to create that number, population data from an average of 2014 to 2018. So the population has definitely increased within our zip codes within the last 2 years.
Okay.
You know, so I guess take it with a grain of salt, and you know, like you mentioned, you can't take it as the gospel.
Right.
You know, it's as accurate as we possibly can get right now, I would say, from the Kansas City, Missouri Health Department.
But not
But yeah, I mean,
maybe reflective exactly of where we
Exactly.
are population-wise.
Exactly.
Okay.
That zip code data gives us the best indication in terms of our community within the school district. That it would be the best representation.
I also wanted to clarify that we would not make a decision as a district in isolation without the relationship and conversation and commitment of the health departments.
That's absolutely true. They've told us all along they have veto power over us, and so if they don't feel comfortable with us being in school, they will let us know, and we will certainly work with them. I would also say that zip code data, are they able? It's still based on positive reports within 24 hours, and then all other reports within 2 to 3 weeks, right? The negative reports. So
Yes.
that's part, because it changes. When we go back and look at it, we'll notice that it changed, and then we found out that it's because that the negative tests have come in later.
Standard you have for positive.
I mean, I think they're doing the best they can right now, and trying to get those cases in and then get those accurately reported. But like Dr. Clemens mentioned, I mean, it will literally change from 8 a.m. to 3 p.m. I mean, there was one day that I came into Dr. Clemens' office and I gave him a number, and then I walked back to my office and got busy doing some other things, and around lunch I checked it again and it changed. So immediately I emailed him and said, hey, that number changed. So, I mean, it's pretty volatile right now.
I believe that reporting information is a policy right now. So whether or not that changes, I don't know the policy. I know that the health departments are working from is the 24 hours positive, and then the negative tests are just within a reasonable amount of time. Our understanding is that is the policy, and that's been 2 to 3 weeks.
Sounds strange. They get the same information, why not report it?
The amount of information we know today versus the very first board meeting we had around this metrics matrix conversation is tremendous. So I certainly feel more comfortable with what we're sharing tonight than I did, was it maybe 3 months ago?
Yeah.
When we had that conversation, and probably in 3 months we're even going to be better at having some identifiers.
May I ask one more question? Other school districts are in the same exact position that North Kansas City School District is as well, in terms of getting the same data. The only difference is that we really do appreciate you doing some inside work on the numbers, because I think it has really helped us out a lot to understand.
Madam President, I slipped during a superintendent's conversation with 7 or 8 superintendents. I was sharing how we were tracking this data, and it drew a lot of interest. And Dr. Shanks had to spend the better part of a day talking to other folks about how he was getting information. So I'll promise I won't share again, Dr. Shanks.
The other data that we're going to be getting soon too from the Kansas City, Missouri Health Department is our positive test rates within our zip codes by age groups as well. And so that's going to be another piece of important information that we can use, along with student attendance, staff attendance, is all, I think, critical indicators of the decisions that we make.
Well, well, Dr. Sutton is really, again, talking about the academic area. I just might ask him if days like today, where the weather was a little bit damp and chilly out, if modifications had to be made to our extracurricular activities or let's say our music or fine arts department type of instruction.
Yeah, in some cases, there was definitely rain in different parts of the district even as I drove through today. And we did have some modifications that had to be made with PE, of course, and all of our choirs and music classes are going to be held outside whenever possible. So yeah, we had to make some modifications today, and our teachers did a great job with it. They're prepared. They know what to do. And again, we kind of go back to having more time prior to today for our teachers to prepare. That has certainly been a help to think about the different scenarios that they'll have to face. But yeah, we did have to enact some of those today.
I have a funny story if I could. I was walking through Meadowbrook with Miss Deanza, and we went down the stairs in that long hallway, if you're familiar with Meadowbrook, and she goes, "Oh no." And I said, "Well, what's wrong?" She said, "Someone parked in the music class. They had an area marked off for music to be, and someone had parked their car there, so we had to do a little bit of adjustment there." But I am very pleased that our staff is working hard to try to identify locations so that those extracurriculars can continue to happen.
Dr. Clemens, I think I'll turn it back over to you.
Yeah, appreciate it very much. We'll certainly continue to entertain questions, but I know we have one other thing we want to accomplish tonight, and that was to start talking about future workshops. This was kind of an easy one, first day of school, but we really want to encourage the discussion, and I know October, if you would, I would suggest that we look at student assessments and how you are going to hold us accountable for student performance. I know that that's a big one we've been looking for some time, and that would coincide pretty well with the goals that I would be asking the board to approve for myself. And so if you would be comfortable with that one, I certainly would appreciate it. And with that, I'd like to turn it over to Dr. Daniels, as she was going to share a little bit more information and get some feedback on future board workshops.
Okay. You'll see the calendar that Peggy provided for you. She highlighted the ones that would be board workshops. So we've got several opportunities to have further discussion like this, or we could get into some of the articles, the research, the book excerpts. We could apply a problem-solving model. We could apply a SWOT analysis, strengths, weaknesses, opportunities, threats. We have a lot of options for this type of format since we are pretty much making it up as we go. So what I'd ask you to do is to think about topics and then think about different venues, different ways that you would like to attack that information. What would it need to look like? What would you like the structure to be? After we brainstorm some topics and or structure for the time, then I'd love to talk with you more about maintaining the 7 p.m. start time, live streaming continuing, and then locations. Do we change them or keep them consistent? So we've got a few other things to figure out, but I'll give you a few minutes first to just brainstorm topics.
One of the things that I think would be a little bit helpful and to determine our future topics again is when we do talk about our student achievement specifically next month, if we want to have a further dive in our student achievement by building. I know that it was mentioned here in the last month or two that we have not really looked at that by building for a couple years. And my point with that is if there's further improvement or recommendations that would be required or recommended specifically at a building level, then maybe we could take future workshops to dive deeper into that data. To me personally, I would rather spend our time dealing with student achievement and specifically dealing with building by building student achievement on how we can raise all buildings rather than waiver in other areas and get sidetracked by just looking at district averages.
And again, I agree with what Mr. Harrell's saying, and we'll certainly be able to do that. The goal for the October meeting for me would be to select and to determine what assessments we would be utilizing to set that up. So for instance, third grade reading scores, how proficient our third graders are at being at grade level. What a goal of mine would be is to agree on the assessment, to determine the level of proficiency, and move on to really set those learning targets so that we can provide that information back to the board. I do think we have some measures that we could share by building level, but I think the goal from the board, to me, was let's get away from the DESE assessments and let's determine the local assessments that can be utilized so that we can hold me accountable for improved student performance. Does that kind of make sense in terms of what we would be bringing to you in October? Because I want to make sure I bring the right thing for discussion.
Right, I guess what I would say is I would be more interested through the remainder of this year, again, about specifically talking about what is going on in our classrooms, building by building, than books or articles that our board could share.
Okay.
I'm more interested what the students, what their level of content is versus just general content that would be shared with board members.
Well, we're probably a little ahead of ourselves here, but just to hitchhike while it's hot, I don't think one negates the other. I think there's a generic set of achievements, and that can be broken out down the road, I mean, as we go. So certainly we have one of the opportunities COVID has gotten us is DESE's inability to come up with a new MSIP. So now we can really get down to what I think are some much better ways to measure student achievement. So all for it.
And I would say too, just to keep in mind that, remember last spring, we didn't have any student achievement data from MSIP as well. And so if we're talking about that level of student achievement data by building, we didn't have that. We didn't have ACT. There's a significant amount of data that we typically would have that we don't have, which again provides us with a great opportunity to think about other data points too as well.
Dr. Daniels, I'm not sure where this discussion is going, but I guess I would like to suggest I completely support Mr. Harrell's recommendation about focusing on student achievement, but I would suggest that the January meeting might be a little bit different. That's the time when we normally set the parameters for the budget for the coming year so that we know where we're going. It would be halfway through the year. It would be seeing where are we as we've been negotiating our way through COVID and the extra expenditures and kind of dollars and data, I'd crudely call it, just because that's the point that that's a point of inflection. As we start to look at it, we start to set the priorities that not only does Mr. Fritz use them to draw the budget, but we also start to set priorities about what we should be anticipating in the way of student-teacher ratios. Where do we want to increase this, that, and the other as far as programming or anything else? So not just looking at a couple of the numbers, but some of the major determinants. And so the drivers, yes, thank you. So I would suggest that might be a worthy workshop for January. The timing would be good.
Okay, so while we're brainstorming ideas, so far I have achievement data by building rather than district averages. Certainly the metrics for student achievement per the balanced scorecard for October 13th, and then the January meeting being setting parameters for the budget, assessing the impact of COVID, etc. Okay. Other ideas?
Topics. I have 4, 5, I can't count my own numbers here. The first one I put was academics. And I'm talking about a whole way of looking at how we measure student achievement and going in depth and studying other states, other cities, other school districts, other countries, and going deep, as they say. We used to say when I was a young person, be thorough. Now we'll take a deep dive. That's the current thing, right? My second one was the environment. How do we want to model? We're teaching our kids to be responsible in terms of the environment how as a district do we want to model that? What does it say about our facilities? What should we do it around serving plastic spoons, et cetera, all that kind of stuff. I put facilities relative to new learning models. We keep building buildings like we're gonna teach kids first grade, second grade, third grade. And I keep hearing educational academic studies about if a kid's smart enough at the age of 12 to be in the 8th grade, why don't we have that person in the 8th grade? So I'd love to have a workshop around that topic. Two I have that might go together are us just talking about what do we think this district ought to look like in 5 to 10 years. And develop, as a board, developing a vision for what will learning look like in 5 to 10 years, and how can we do that in a way that's helpful to our students. And I also put in thinking differently about the way we do strategic planning.
Thank you.
Yeah.
Other ideas? Brainstorm.
That would be circulated, that then we know what our parents of the community want us to be talking about, what they think we should be talking about, what are issues that are important to them. And then mental health, our students.
Thank you.
I'd like to suggest the way possibly, I mean, this kind of goes along with, future district and things like that, but like really reevaluating the way our days are structured, the way our calendar year is structured. I mean, if anything, I think this virus has told us that you can have school at all different times of the year, and you can better utilize your facilities that you do have. And you don't have to be locked into an agrarian, we're not harvesting crops here anymore. And yet we still have a school schedule that seems to reflect that. And so I think we need to maybe look at that a little differently and talk about how we can, especially with the technology that's out there right now, and making that reflective of what that future is going to look like for those children. So I would like to see that. I'd also like to be able to discuss excellence within the district itself. I mean, I know, again, we talk about, third best district and all of these kinds of things, but we're still in a state that's 42nd nationally. And, it seems like we need to reevaluate and look at all of our programs and shift the paradigm from, what warm body do we have available to sponsor this activity versus, is this an activity that's worthwhile? And if it is, let's put our money where our mouth is and use resources to make that happen. Otherwise, let's not play or participate or build or do or whatever it is we're doing.
Okay. So, thank you. Other thoughts?
Been listed under the futuristic perspective. Probably the other thing though is because I feel like we're just beginning the portrait of a graduate in the high school development and all. I think we can continue to learn through that as a board and help continue to actively participate in discussions around that. And that's on our scorecard, so I think it's pretty important this year.
You know, part of it is around portrait of a graduate, and I agree with that completely. But I think the fundamental question that we began to explore with the portrait of a graduate is, how should we structure our high schools? How should we structure our learning processes? And if we're doing that at high school, how are we doing that at middle school and sixth grade centers and K-5 and pre-K? And so I think that whole discussion, and it kind of goes to the comment that Jane made a moment ago, just really kind of unfettering ourselves for that discussion so that we can truly explore or not be constrained by the same way they've done it since 1908. And what should we be doing? How should we be approaching this? I mean, Dr. Sutton earlier mentioned that we're learning a lot about what the technology can do to support different learning schedules, processes, and everything. And so I think, I don't know where it fits in these, but I think that's something that we really need to have just kind of a, you know, a wide open discussion that's probably going to be a little bit frightening at some level, because we'll be, if you take down the four walls and say, how would we do it if we started tomorrow? It gets us to a different place.
Well, one of the advantages of the time is, with COVID being such an interrupter, it's just like Carrie alluded to, what parents are thinking and all around choice or preferences and all. We really have a huge opportunity to introduce and address all of those. And we're at a point of growth in the district that it also gives us more flexibility in some ways to then implement some of the inventiveness that we've discussed. So.
Just one other thing I would add to that discussion, I'd be very interested in hearing from some of our teachers as to if, you know, if we weren't stuck in the model we have today, how would they like the model to be built for them to be most effective? And so I think the teacher voice needs to be, just as the parent voice, the teacher voice needs to be in our discussion.
Dr. Ward triggered one, got triggered again, teacher pay. It's always to me the big gorilla in the room that we hate to discuss. When you look at professionals that are competing with teachers and the acceleration of the pay and the gap between what teachers get paid versus what their peers get paid is huge. We're asking Dr. Gaddy to work with one arm tied behind her back. So it's just much more difficult. The pool has narrowed. And so I just don't think we can ignore that. I think we ignore it at our peril in the country, let alone just our district.
You know, going along with that, we have in place a 10-year facility plan that we've got stuff put there, and I mean, it's using the best knowledge and the best framework that we have available to us. But if we take what we've learned and we can say that there is a better way to do education than every student in every seat, 5 days a week, dawn to dusk, then all of a sudden, maybe we don't need one of those elementary schools we were planning on. I'm just picking that as an example. That would be $23 million that we have in the facility budget out there at some point in time. And conceivably, we could take that 23 million and maybe what we do is we invest in technology so when we have teachers that are teaching face-to-face and virtual simultaneously, maybe we beef up the technology in the classroom so it becomes easier for the teachers to do that job. And, you know, with $23 million, we could go a long ways down that road. Now, I'm not advocating, but I'm just throwing out as an example something that I hope we could delve into as we try and understand how should we be structuring and what should the priorities be. Maybe we use part of that 23 million to go ahead and finish a couple of our net zero ready schools and make them net zero. I mean, there are a number of things that could be done as we start tying together some of these strands that my colleagues have already mentioned and look at how does that interface with our traditional expenditures, both operating and capital, and really kind of, again, throwing the feathers off.
Other thoughts? Okay, at this point, we've got a comprehensive list that we'll try to align and combine. I did hear some connectivity between a few of them, though, so we'll get that compiled for you and get it back to you as well. Now I'd like to just ask you a few simple questions. We'll try to garner consensus on it. First, session format. Right now, we are being live streamed. Is that something that you think is productive for this type of a session? It encourages conversation, encourages discussion, or is it something that you think would not be a part of the workshop session, but would remain a part of the board meetings that we have at the end of the month? So consider that for a moment. So live stream is the question moving forward, since this has been a new practice we've established.
Well, my personal opinion would be if we're going to live stream one of our meetings a month, that we should live stream both of our meetings a month. Again, this still is a public meeting. Still, the board members of the Board of Education are coming together in a public setting. The meeting still has to be operating in subject to the Sunshine Law. And so really what I'd say is if we're going to put our efforts to live streaming one meeting, that we live stream all of our public meetings in this type of setting.
Does anyone have a differing opinion?
I mean, since we're not sitting at home watching this, it's kind of difficult to say, yeah, this is the greatest thing since Spartacus, or, you know, we really shouldn't do this anymore. And I don't know with modern technology whether there's a way for those who are watching to send in questions or that sort of thing, like when you listen to radio shows and they're always saying, tweet us at this account and that sort of thing, to reach out to the community members that would be concerned and would want to give their input.
Okay. So it doesn't sound like we have a differing opinion. I'm going to ask you to give me thumbs on this one. If you are in agreement that we continue live stream for both meetings per month, give me a thumbs up. If you're a little wishy-washy about it, give it to me here and then this. Ready, go. Okay, that was easy. Thank you. We will continue to live stream and then perhaps seek out opportunities to further engage the community doing that. Another one that I hope will be something we can reach consensus on. Do we want to maintain the 7 p.m. start, or would you be interested in altering the start time for the workshop sessions?
Something different.
Something different.
Well, personally, I'm going to speak up that I actually work during the day, so I would prefer the meeting to continue to be in the evening.
I guess I think there's benefit to consistency. I mean, the people in the community that are gonna come in on live streaming aren't gonna remember whether it's a 5 o'clock, a 6 o'clock, or 7 o'clock. I think maintaining 7 o'clock's when the board meeting is, and they know that. And it's, unless there's, we've had clauses where we needed to move it, but unless there's a reason, I think standardization is helpful.
I was gonna say, I just think that, if we do this kind of meeting well, it will be longer, not shorter.
Other thoughts? Bring your sleeping bags?
What's that?
Bring your sleeping bags? Is that what you're saying?
No, I'm a night person, so
Okay.
I can do 10 o'clock to 2 a.m. That'd be fine with me. It's the morning that would kill me.
Are we ready for a consensus vote on this one, or do you have further discussion? Let's see those thumbs. If you would like to maintain a 7 p.m. start time, give me a thumbs up. Show me where you're at. Okay. Okay. Looks like we will maintain the 7 p.m. start time. Finally, the last question would be locations. We had talked about at one point varying the locations, going from school to school so that you could see different sites up more closely. But as you can tell, it would present a challenge in structuring it based on the size of the room, our ability to live stream, the audio quality. All of those things have to be factored in too. So I'd love for you to weigh those two and determine whether you'd like a consistent location for our workshops, or would you like to see separate areas throughout the district and vary that? Dr. Ward.
I guess I would pose a question, and that is, how much do we want to spend on supporting board meetings? I mean, to get all of the technology in place, to get it tested, to make sure it's hooking up and being live streamed properly. All of that is an investment of staff time. And I like the idea of floating it, but I think if we're going to go to more of a technology-based interface, right now, while we're in the early stages of learning how to do that, is probably not the time to start floating. When we get to the point that we've got, like the band, you got your 3 vans, you load them up, everything has its right place and everything's there, and you go in, you put it in, you go. We're not there yet, and I don't think we'll be there this year. By next year, maybe we can.
So you would advocate consistency? Others?
Great opportunity for us, but I think there's also some cost-benefit analysis when you're having to drag all of this equipment and people every time that becomes very difficult and cumbersome, and then you really can run into technical difficulties. And what are you going to do if you're at an outlying school that may or may not be able to have the extra cord or whatever they need to plug in that day?
Okay, it feels like we're ready to show thumbs on this one too. And team in the back, let's not vote, okay? Let's not see your thumbs. All right, if you would vote to maintain a consistent location, give me a thumbs up. Okay, All right, I believe those were the items that I was supposed to walk us through. Thank you.
Thank you very much. All right.
Now we're gonna talk possible processes. So I'll just throw out a thought that some of these topics, if we all took them on, the whole board at one time, wouldn't make a lot of sense, but there are some that call for task forces. Smaller subset of the board that can do the deep dive, come back to the board, present options, research, et cetera. And the board discussions could be based off of that. Some of these make sense for the whole board to talk about, brainstorm, et cetera. While I'm at it, I would say to the audience, by the way, that the live stream, the kind of thing we're talking about, feels risky to us as board members. You know, there's such a thing as brainstorming where you say what's on your mind. May be a crazy idea at the time, may not. And you're always worried somebody out there will misinterpret your thoughts. So I appreciate the willingness of the board to take those kind of risks with the public. So.
T, what I'd propose, if it's all right with Dr. Clemens and President Kauck, is that we compile the list that was brainstormed today, aggregate some of the items, and then based on the topic, determine what the best process to apply would be. We could put something like that in the Friday update this Friday, and then get your feedback on it so that we are making the best decisions as to which topics are covered, but then how we attack them, how we approach them. Would that work for the board?
Well, I'm okay with everything but the aggregate. I think each person's idea ought to stay independent till we as a board decide to aggregate or not aggregate.
Okay, would you agree though there were some similar themes I might be able to collapse?
I'd just rather have the list as it is.
You got it. Okay.
I'm comfortable with what you've proposed. So I think, again, we're going to kind of be making hamburger as we go. It's just going to evolve as we go through and learn ourselves. And if we are open to assessing and are having some kind of little assessment follow-up tool at the end of the meeting to kind of talk about what worked, what didn't work, maybe that would be really helpful for us to continue to look forward at our own work, self-evaluate. Any other comments? Are you good?
I'm very good. I just, in closing of my part, I'd just like to say thank you for the discussion. I know today felt a little bit awkward, but I think as we continue the workshop theme, that we'll start to have better discussions. And I think today was a great start. So appreciate your willingness to change our format just a touch.
So can I just ask a question? Again, a little bit of a process here. So the topics that we would be discussing would be discussion, for the most part, would be discussion only. And if there was action required on those items, would they be brought forward as part of the public agenda at the next business meeting?
Well, in talking with a couple of the school districts that have moved toward this, occasionally there's been a situation where something was a little bit more timely and might need to be put on as an item of new business, but generally that would be an exception, not the rule. So I think your assessment would be correct in terms of rolling information. Do you have any other feedback on that, Dr. Clemens?
No, generally, and we've done that in the past as well. With some of our education meetings, we've snuck a few things in there and asked for approval. But as a general rule of thumb, we try to do most of that during the business meeting.
Well, one of the things, again, to consider too is just that we don't really maybe extend over, well, what I'm trying to say is we'd have a full discussion about an item in meeting one, the workshop. And then again, for formal board action, it would be brought back to the board a second time. So my question would be is how much has to be rehashed at the second meeting that was already discussed at the first meeting also to continue that dialogue. I mean, I can see where that could happen also.
Well, my sense about some of that is if we can provide succinct clarity for the community who might not be attending the workshop, it would be just maybe helpful to give a synopsis of information that was being approved, or is that what you're asking?
Right, well, I guess I'm just thinking about different situations where, again, we spend considerable amount of time discussing an issue, which is fantastic, but again, 2 weeks will have passed, and 2 weeks of additional input could be provided to board members, the community, et cetera, both pro and con. And again, I might have a different, I might have more follow-up questions in 2 weeks before I'm ready to approve it, because additional information has come to me, or I have thought of something different that I would like to ask before it's finally approved. So I'm also concerned about extending the length of the meetings.
But perhaps them not just going into consent
Right,
agenda either,
right,
though.
right,
They
right.
would be truly new business. Yeah.
If there's a controversial subject, more than likely, there will be additional information that would be shared by our staff, our students, our community members with the board before that 2-week period had ended and before a vote had comes up. So therefore, some of the same topics might be rediscussed or open before a final vote is taken. I'm just pro or con. It's just again in total transparency.
I understand.
Just got to how this will work.
Mr. Harold, you might think about it differently, but there are topics on here in my mind. We use the SWOT, strength, weaknesses, opportunities, threats. Okay. They want to talk in code because I ask people not to do that. Some of these topics may take 6 meetings.
Right.
I don't see us having a topic once a month. That's not how I see the workshop in my head. So if other people do, we might need to talk about how we perceive it. If there's some kind of, oh, let's have a nice discussion on such and such, and that's not where my head is. So.
Any other thoughts? We close? All right, very good. Well, at that point, then the meeting is adjourned, and thank you so very much for providing feedback, and congratulations on a really wonderful start to the school year.
Thank you. I appreciate everybody's help to get us to this point.